Hi, everyone. My name is Feo Poukhovski-Sheremetyev. We're here at the Access webinar for COVID-19 Navigating Post-Secondary Education and Youth Mental Health. We're also excited to be here. We might be physically distancing, but certainly we're trying to keep socially together in these difficult times. This is the first in a series of webinars on COVID-19 and mental health. And before I dive in and introduce the topic, as well as our wonderful panelists who will be speaking to you today, I just want to remind you that you can ask our panelists questions today, either by using the Q&A function at the bottom of your screen in Zoom, or by asking questions on Facebook Live. This webinar is going to be recorded. You'll be able to watch the recording on Facebook after we're done. So on the topic, post-secondary education and youth mental health in a COVID world. Post-secondary education is inextricable from COVID-19. The effects of physical distancing have been myriad. And both COVID and post-secondary are inextricable from mental health. So let's start with post-secondary. What's going on with mental health there? The National College Assessment of 2016 found that 46% of post-secondary students reported feeling too depressed to fully function. Nearly 2/3 of students reported experiencing overwhelming anxiety, according to the latest Canadian National College Health Assessment. I'm a medical student at the University of Ottawa. We had our 5th student death on campus in 10 months due to suicide. U of T had their 4th death on campus since 2018. People are calling what's happening on campuses a crisis, a mental health crisis. I myself am skeptical of the term crisis, more significantly because I wonder whether it's fundamentally an issue of mental health on campuses or more so symptomatic of broader sociopolitical crises. But in any case, this is a serious, significant issue. And now COVID-19. An Angus Reid poll found that half of Canadians reported a worsening of their mental health during this pandemic, with 1 in 10 saying it has worsened a lot. How does that layer on to the existing mental health issues existing in the post-secondary context? Students are switching to e-learning, students are isolated from friends and family, students are unsure about their job prospects. How is this all going to play together? There's a breadth of research on the terrible effects of isolation on the individual psyche. And that's not even mentioning the idea of COVID as a mass traumatic event that's going to have repercussions going far into the future. And that's not even beginning to talk about all the people who are going to come out of this jobless, potentially homeless, who may have been isolated with an abuser, who have had loved ones die. At the same time, I don't want to entirely view the COVID situation pessimistically. We are talking about isolation, but we're also seeing spectacular displays of people overcoming isolation, connecting more deeply with their neighbors and communities than ever before. Much of my research as a post-secondary student is focused on the ways in which the capitalist economy isolates us from our communities and may be causative in mental health and mental illness. So seeing these potential offshoots of community building, grassroots activism, selfless volunteering for the most vulnerable in our society, I think it reveals just a very beautiful door to a better future. The question then is, how do we open that door? To at least try to begin that question, here we are. So though this is a webinar, it's less of a lecture, it's more of a discussion. We have some very unique and very different voices who are all going to be telling you about what they're seeing during these strange times. The idea is to explore the challenges, but also the opportunities for addressing those challenges and to provide recommendations for going forward in regards to post-secondary, COVID-19, and mental health. So without further ado, I'm gonna introduce our panelists. They're gonna speak a little bit about themselves, and then we're gonna go straight into our structured questions. After that, we're going to look at your questions that you've posted. So we'll start with Emily Saunders. So if you could introduce yourself, please.
Hi everyone. As Feo said, my name is Emily Saunders. I will be entering my 4th year at Wilfrid Laurier University in Waterloo, Ontario in the fall. I'm currently enrolled in a health sciences program and hope to obtain a degree in medicine in the future. When I'm not at school, I live with my family in Chatham, where I sit on the Youth Advisory Council for our local Access Open Minds site. I'm also involved on a national level as well, and this year I had the privilege of being appointed as one of the co-leads for the National Youth Advisory Council. I'm so glad I have the opportunity to participate in this webinar, as student mental health is something that is extremely important to me, whether or not the world is in an emergency situation. In my spare time, I enjoy dancing, running, and reading, all useful tools I use to help manage the stress that comes along with the life of a busy student.
Thanks so much, Emily. Our next speaker is Kevin Friese.
Hi, everybody. I'm Kevin Friese. I'm the Assistant Dean of Students Health and Wellness at the University of Alberta. I have the privilege of supporting an incredible team of diverse support specialists within our community that address the health and wellness of our campus community, and also directly support our Access Open Minds site at the University of Alberta.
Thanks, Kevin. Next we have Gina Dimitropoulos.
Hi, my name is Gina Dimitropoulos, and I'm an associate professor with the Faculty of Social Work at the University of Calgary. And my training is obviously in social work. I work as a social worker for over 20 years in the area of youth mental health. And a lot of my research now is in this area as well. I am very passionate about youth and family engagement, peer support, and am involved in leading with a number of colleagues and Kevin, a project that's specifically looking at best practices for supporting young people who are transitioning from secondary to post-secondary school who have mental health issues and problematic substance abuse. I'm really delighted to be here and to be with my esteemed colleagues. This is a real privilege. I'm excited that this is happening. Thank you.
Thank you, Gina. And finally, we have Alison MacNeil.
Hi, so my name's Alison. I'm originally from Ottawa, and I studied health sciences and social sciences there. And then I got to work for Access Open Minds for 2 years here in Montreal. And actually, it's so great to be back working on an access focused project right now. So it's great to see everyone. The last 2 years, I've been pursuing my PhD at McGill. So I'm doing a PhD in clinical psychology. And my research focuses mostly on adolescent and emerging adulthood mental health, and especially looking at food insecurity and other sort of material deprivation and how poverty impacts young people's mental health. I've also spent the last year providing counseling and psychotherapy at the McGill Student Wellness Hub, so providing mental health care to students at McGill. And next year I'll be at the Jewish General Hospital at the Herzl Teenage Health Unit, so doing outpatient mental health with teenagers in the Montreal area.
Great, thank you so much, Alison. So that is our wonderful panel. And without further ado, we're going to jump right into the questions. So our first question is, what barriers do you see currently, or maybe that you're currently experiencing, and how are they affecting youth mental health? Barriers in education, that is. So in looking at that question, we thought, who better to ask than a student about better barriers to education? So we're going to start with Emily Saunders.
So in an emergency situation, there are many barriers to education that I've found have come into play, both personally through my experience being a student and as well hearing from peers and other students around the world as well. So students have been forced out of schools and forced to finish the remainder of their semester through remote learning at home, requiring assignments and examinations to be completed online. This can be a bit of a problem, as some students may not have access to their own devices, such as laptops or tablets, or they might not have access to a stable internet connection, which can make completing online tasks nearly impossible. When it comes to online examinations, students are often required to enable a feature that locks their device down so they can't access any resources. And this also films students writing their exams so as to avoid academic misconduct. While I do appreciate the idea around this, I don't particularly enjoy being filmed while I'm writing a formal assessment. I find that I'm constantly worrying that if I move the wrong way, it might be assumed that I'm trying to cheat or access a resource, when in fact I might just be stretching, trying to get comfortable, or zoning out to find a train of thought. Some students might not even have a webcam, and some professors in schools have been less than sympathetic, I've found, saying that if students aren't able to access these online tests, they will be forced to either drop the course or accept a failing grade, which I do not believe is fair. These are stressful times for everyone, and students didn't plan for this, so I most certainly don't think they should be punished for this. In terms of mental health, these changes can involve increased stress. I know I'm not a person who enjoys change, and this completely messed up my routine, so it took a while to adjust. And it also can come with feelings of isolation, whether you're a student or not. I'm fortunate enough to be home with my family, but some people might be living alone or in a profession where they don't feel like it's safe to go back to their families. They might find it's hard to be separated from their friends or separated from their partners. So this can have a huge impact on mental health, both in terms of stress, anxiety, depression, and all sorts of other factors.
Thanks so much, Emily. That's really interesting that you raised sort of the discussion also on sort of the surveillance that the university has to do on students for proctoring. We often talk about that isolation and being isolated from your peers as an issue, but I think that's an issue that's been raised a little bit less, that invasion of privacy. Yeah, that's fascinating. And I think it's that kind of actually segues very interestingly into our I think another person who could respond to this question really well, because having asked a student about what the barriers are, I think it's really interesting to also ask a professor what the barriers are and sort of the way that they're perceiving all of this coming from the other end. So Gina, how do you see the barriers to post-secondary education and their effects on mental health today?
Well, there are a couple of things that I've been thinking about, and I think that some of the barriers are, just to echo what Emily has talked about, I certainly have observed and witnessed some of the same ones in our student community. I think there are, just to kind of reiterate a few things that maybe have already been said, and then to add a few other things, is that I think that we're all social beings, and I think that transitioning to self-isolation and having to make rapid changes to return home, wherever home is for people, and not having the regular contact that we've become accustomed to with our colleagues, with faculty, with staff, I think has had a profound impact on people. I think when you're a student, all of us, our identity gets very much shaped by the work that we're doing, and we find meaning in our work. So I think that I have also observed that a barrier might be just the grief and loss that we're all experiencing, no longer having the same kind of connection to each other and to our work. There's something to be said about seeing your cohort, your students in class, and then connecting with them afterwards and being able to see them socially and be able to talk about the meaning that you're attaching to your experiences and what you're learning. We're not having those kinds of opportunities. I think in particular for students who are in their final year, I think there's lots of angst about what this means for them in terms of their future. There's a loss of rituals and ceremonies and opportunities to also mark the ending of school, people's diplomas, degrees. So again, there's some grief and loss. I think people feel a little bit kind of cheated, like I've missed out on some opportunities that I'm not going to have, and you can't claim again. I think for students who have also are struggling with social determinants, I think that all students are probably really struggling with economic challenges. and having to, you know, they may not have the opportunity to obtain a summer job or summer studentships. Like there's going to be a huge economic hardships that I think students are going to experience. So that makes, I think, students very anxious about their future and how they're going to be able to afford their education and housing and food. So there's also those layers that I think make it more difficult as well. I do want to just also highlight, I think that as a professor and as a social worker and a researcher, I think some of the other things that I've been hearing about that I'm acutely aware of is that students who have, you know, pre-existing or current or emerging mental health issues like depression and anxiety, I think, have lost access to services that might have been available through their campus community, or they maybe have lost access to traditional mental health services that they might have been able to obtain through in the community, because so much of our mental health services have also been transformed. I think that there's also lots of angst that I'm hearing about people anticipating what life will be like and there's so much rapid change happening all the time. So people are kind of wondering, students are wondering what will their academic year look like as we move from self-isolation, social isolation to normal life again. And that could be particularly difficult for people who are struggling with mental health issues like anxiety, depression, eating disorders. So I think there's lots of challenges, and they really do vary across different student groups as well. So I'll just end there. Thank you.
Yeah, thank you. It's interesting what you mentioned about access and the sort of idea that so many resources that are available for students are available on campuses, and with the shutting down of campuses, that suddenly all kind of fizzles away. We're going to be, I think, discussing that a bit further in this webinar as we talk about what opportunities are for post-secondary institutions to support students in this period. But I just wanted to ask a little follow-up question to what you said about rituals and sort of the loss of these transitional rituals, such as graduations, but also rituals for people like weddings and funerals that are so important in our lives. My question is just, have you found that sort of attempts to replace these rituals, for example, with online experiences, have been adequate, or do you think they really fail to capture that experience?
Would you like me to answer that, and Emily as well?
Yeah,
I just take a stab at it first, and yeah.
Mm-hmm. Yeah, and if anyone else has something to add, yeah.
Sure. I'll just quickly say that I think that although we're talking about kind of some barriers to education and some challenges, what I'm really struck by is the resiliency and how people, students have come up with some really creative ways to continue to honor, these ceremonies that we're talking about. So I feel like technology has played a really important role in allowing people to continue to support each other, to continue to have ways of celebrating important events in people's lives. I think that we're all adjusting very quickly, and I think I feel like what I've also observed is that not only are people finding new ways of communicating, sharing, celebrating, honoring people's experiences, but I think being more compassionate with each other and with oneself around these difficult times, and recognizing that we're doing the best that we can. So I'm seeing a lot of resiliency and a lot of support, and in ways that I don't think we've seen before. But during, I think, a very difficult time, I think there's something about all of us going through this that brings us together and creates a sense of universality, that we are in this together. And that already builds that connection and that opportunity for honoring our experiences.
Thanks, Gina. Is there anyone else who would maybe want to dive into that question as well? Sort of talking maybe about that way in which students are finding ways to replace kind of classic day-to-day activities, rituals, whether it's working or not. Even Emily, I'd be interested in hearing, because I'm sure that you're taking part in those sorts of activities as well, maybe seeing your classmates every now and again. Do you think that it works? Does it help in these times? And does it help enough?
I think we're definitely really lucky to have technology, and I think it helps as much as it can through this time. Of course, I'd rather be in class one-on-one, or not one-on-one, but like in person with my professors. But I've definitely found ways to try to keep some normalcy going. Like I know a lot of my classes had pre-recorded videos for when we moved online. And in certain situations, I actually found this more helpful, especially in science classes where sometimes if you miss a concept, it's hard for the professor to go back. Whereas in this case, I found if I was struggling, say, with understanding carbohydrates, I could go back and watch that video as many times as I needed. I definitely preferred my one class where we actually stuck to our regular meeting time and had a lecture over Zoom. And even with some other activities I do, like my dance classes, it's been nice to be able to continue those over Zoom to try to keep a little bit of routine going. And even just stuff as simple as FaceTiming my two really close friends. We always would get together for a couple hours during the week to study together, so that helps us to keep routine going as well, even if we're just sitting and catching up.
Yeah, and I can really relate also to the idea of the loss of schedule and how helpful it is to have activities that kind of put you back into the structure. I think it's so easy to get lost in kind of this flow of days in the pandemic. Yeah, thank you both for those really interesting insights. We're going to move on to our next question. And just sort of to maybe contextualize it, in organizing this event, the organizers and I kind of spoke a bit about something called the post-clinical approach to mental health. And just to sort of ground that, and an Ontario study found that a quarter of children and youth waited 3 months for a consultation with a mental health specialist. It's a really long time. And I think that kind of all of our panelists here working in various facets of mental health know about the long wait times. And that's not going to fly if the theories about COVID-19 being a massively traumatic event hold any water. There's just going to be too many people who are going to need services. Returning to the Angus Reid poll of over 50% of Canadians feeling mentally distressed, let's say most of those people come out of COVID when all this blows over feeling well. It kind of passes them over. Maybe only 10% of those people are going to have lasting consequences. That's well over 1 million people. If only 1% of those people, being very conservative, have lasting consequences to their mental health, that's going to be 185,000 about. Those are huge numbers. So how can we continue delude ourselves in saying that throwing more therapists, for example, at the problem is a viable solution? Of course, that's, I'm in medical school. I want to, at this point, do psychiatry. So I'm not discounting the importance of therapy, but the idea is there's just too many people. It's unsustainable. And that's what we mean by post-clinical. So what does a broader, more integrated, more social approach to mental health look like when you have a population that's been so heavily impacted by a possibly traumatic event? So the next question is then, what are the opportunities for universities and other institutions to support youth mental health, both in a clinical context, fundamentally important context, but also a post-clinical context? And I'm going to throw that question first to Alison, who is already in a lot of ways on the front lines of kind of the whole mental health situation in our country, but in the coming years, even more so, is going to be heavily involved. So what are your views on sort of the future of mental health in that way?
Thanks for the question, Theo. So, I think like you said, there's two parts, right? So if we consider the clinical dimension, for sure, we are expecting that the demand for mental health services is going to be increasing across the board. Already, with the team I'll be working with next year, we're already trying to devise new groups and new things that we can offer young people who are going to be struggling specifically with the pressures and the trauma of COVID-19. So staying in sort of the university or the post-secondary lens for mental health services, what I've really realized over the last year is that even within a prestigious, quote unquote, well-funded university where there's so much expertise available. We're in a major city close to so many hospitals and so many resources. We have all of this richness around us. We're still not able really to deliver, on those 5 access principles, let's say, the early intervention and the rapid access. So it's puzzling in a way, and for those of us who are clinicians working there, I know every clinician is working super, super hard. I mean, I had a packed caseload and I was seeing clients every 2 weeks. I wasn't even seeing my caseload weekly unless people were very severe, because I was just trying to take as many people as possible. So for sure, I think that universities could, like you said, increase investment, pay more people. But I think one piece, at least that I've noticed was missing in the institution where I was working, was sort of the youth engagement piece. So, young people, especially at the university age, are incredibly engaged, volunteering almost more than any other segment of the population. They care about issues. They're just, and they're learning so much, and they're in this context, being in school where they're really developing their own perspectives on things. So I really think that that's a underutilized resource in how we can make student mental health services better, is actually engaging with students. This year at McGill, there was a protest in front of the Wellness Student Hub, which is where I was working, protesting the long wait times. But nothing came of that in terms of actually talking. Students care, they want to give their input, and they want to contribute to making a better system. So I think on the administrative side, really engaging with the student population as equals and hearing them out, I think would be really important to sort of finding these solutions, and also tapping into the expertise in terms of faculty members who have expertise in all these areas, research projects, integrating these services into all the other, opportunities that exist within the university realm, I think would be really important. But, as we said, there are sort of these broader systemic things as well, right? So one thing we know from other disasters or sort of crises, for example, Hurricane Katrina in New Orleans, is that the existing inequalities that were there before the crisis are exacerbated after the crisis. So from my perspective, I think everyone might be impacted to some degree by this, but I am expecting that students who are already experiencing, housing insecurity, who are already experiencing food insecurity, who may be part of a racial minority, people who are already sort of being marginalized or oppressed by these systems are going to be impacted even more, whether it's materially or sort of through discrimination and things like that. So I really think that is where we need to be thinking about making sort of broader systemic changes in universities, despite that, these are sort of, again, these prestigious institutions. A ton of students are accessing food banks on campus. In Montreal, our campuses are right downtown, which means that the grocery stores and the restaurants are very expensive. It's hard to feed yourself. It's hard to house yourself. And these are things that the university could act on to make sure that students, to get rid of this sort of trope of the starving student, as if it's normal to sort of not be eating enough and to be living in crowded conditions or poor housing while you're studying, right? Like students are entitled to sort of comfortable and safe living conditions. And that will, I think, have a big impact on mental health. We can ensure that is sort of better taken care of, whether it was before the crisis and now even more after this. I think it's going to be a huge thing especially with the economy the way it is. So we really have to be looking out for our students who are economically and socially marginalized.
Thanks, Alison. There's so many kind of insights there on so many different kind of strata of the post-secondary experiences. One thing that I kind of wanted to zoom in on briefly maybe was, you mentioned sort of this lack of youth engagement, of student engagement, possibly by kind of mental health services, despite the fact that people are out kind of protesting and clearly very engaged on the level of caring about it. So this is something we've talked about a lot at Access. What for you do you think would be sort of maybe steps forward for kind of engaging the student body in the discussion on mental health? How do you integrate the student voice in how services could be delivered?
Yeah, it's a great question. I think it starts with, from the administration perspective, a lot of humility. And it seems simple, but it's not always easy. Things are run in universities very top down. They're places that value prestige and sort of elevate elitism. And so whether it's faculty or administrators, I think there needs to be sort of more humility and sort of recognizing that students pay tuition. It's you know, they aren't just sort of subjects under these rulers. The students are the ones who are paying to be here and to receive an education. And so sort of respecting their voice in that. Now, it's, you know, every university is different. The way they've organized their mental health services in each place is different. But certainly, you know, the way Access functions with having advisory boards that are sort of become part of the institution themselves is one way that you at least ensure that there's sort of a constant feedback. Now, there's sort of broader issues with that, you know, in terms of how do you choose those members and how are they really representing the voices. But the other advantage on campuses is that students are already organized into student governments and organizations and clubs and advocacy groups. And so working with those existing structures, I think, is really great. You're not trying to, you know, pluck people out of nowhere to come give you advice, and, you know, those people are organized and they're there. So it's really up to, I think, the administrations to listen and to be humble and to be willing to sort of try new things and accommodate what students are asking for. At McGill, for example, so a few years ago, we used to have an eating disorders program that was offered to students, and it was cut. And a lot of students depended on that service. And so sort of because there was this void, this peer support group sort of emerged on its own, created for, you know, young people with eating disorders by students with eating disorders. And that group, I think, would have really benefited from being supported and integrated into sort of the official services that were offered, because, you know, we're talking about sort of a clinical problem, and certainly having some expertise and having some clinical support might have been really useful, but the students were already trying to organize and to fill this gap that they were feeling. So, you know, I think where you see those kinds of movements happening, and those are great opportunities for student mental health services to partner and to get involved and to help those things be as effective and safe and all that as possible for students.
Yeah, and I think it always is really important to underline the fact that students often really do want to be getting involved with these services. It's oftentimes that they're not finding the places, the context created by the institution to get involved. And I think that's actually a really interesting place to sort of maybe bring Kevin into the discussion, because Kevin and I had a really fruitful relationship, kind of I as a student advisor and Kevin working in administration when I was formerly the co-chair of the Access Youth Council at the University of Alberta. So I know that Kevin has a ton of insights into how that relationship between students looking to improve their community's mental health and the university administration can look like. So I'll throw that to you, Kevin, that same question of what the opportunities for universities are to support youth mental health in a clinical and post-clinical context.
Sure, thanks, Feo. So I think, and specifically zeroing in on COVID and the coming months and the realities that that things are not going to look the same anytime soon. I would build on some of what Alison was speaking to in terms of the opportunities for collaboration and taking youth engagement to that next level, which isn't just involvement or general consultation, but really hoping to see students working side by side with others in terms of putting students at the center of care, I think is really critical. as well as the opportunities that exist right now for stronger collaboration between campus stakeholders and community stakeholders. And looking at those opportunities, we often just talk about collaboration, but within our group, we've had conversations at the U of A around what's collaboration versus cooperation and versus coordination. And we've certainly, in the last while, seen some really exciting opportunities that have come up in terms of better cooperation on the delivery of online supports and resources, better collaboration in terms of reaching out to members of our community to create social spaces where people can address feeling perhaps isolated or anxious or depressed. And I think looking at those stronger opportunities for collaboration are really going to be important in the coming months. One of the things that Access has worked a lot on has been with regards to the wrapping around that range of supports and resources that might be required for students. And when we focus in on mental health, we often go to the very traditional idea of what mental health entails. But of course, I think students, you would probably be the first to point out that mental health is affected by so many other systemic factors, as Alison has mentioned. So there are some unique opportunities for institutions to really try to view and address mental health differently in terms of not just looking at the traditional clinical supports and even traditional prevention supports, but looking at how we address the other factors that students face that impact their mental health, whether those are academics and the way curriculum is perhaps structured, the way it's delivered. It's been interesting to see some of the research that and surveying that's been going on recently that has pointed out that there are some situations where the online course delivery has actually provided a better experience for some individuals. And that won't be the case for everybody. But how can we take that knowledge and do program delivery, service delivery, collaboration differently from the very traditional route that our traditional university institutions and post-secondary institutions might be used to doing. I also just wanted to speak to the opportunities that exist for students, faculty, staff to address sleep and routine. And we talked a little bit about ritual earlier. Gina had mentioned that as well. And I think there is strong support and certainly opportunity for ensuring that people not only understand the importance of ritual, but helping support our communities in how to implement that well. Good sleep hygiene, good eating activities are those things that often we know, we all heard it. It's the apple pie and common information that's provided, but in these times, it's easy to see those slide first. And so ritual can become so important in ensuring that you're getting some exercise, getting some sleep, checking in with each other, and doing some of that social connection becomes doubly important. So I think I'll stop there, but I think there's some strong opportunities to do some of those preventative activities that go and are so important with supporting the other types of traditional supports that post-secondaries offer.
Yeah, thank you so much, Kevin. And I think that really underlining of the importance of these preventative approaches of the small things, again, like reproducing rituals in different ways. It sounds like all of this is going to be key in sort of lessening the impact, maybe not removing the impact, because that's probably not possible, but lessening the impact of all of this on students and their mental health. It's really interesting that you know how for some students you found that internet delivery of courses is actually better. We kind of spent the first little bit of the webinar talking about sort of the issues with that, the kind of isolation that comes out, the loss of ritual. But it's interesting. I've also just kind of heard anecdotally from people practicing therapy that certain people with mental illness are feeling better now than they were before the crisis. And it's going to be really interesting to see the actual research on that once all of this passes, because it's the one clear thing is that there is no homogenous response to what's happening. People are responding in their unique individual ways to the crisis, and sometimes their responses might actually be positive. So that's really interesting. Kind of working off what you said, sort of, and also what Alison said about youth engagement, and this idea of like preventative approaches, I think it'd be really interesting to hear Emily's perspective on this as well, as a student, sort of kind of in working with your university, in being delivered courses in this e-format, and then sort of seeing what the issues are. What do you think the opportunities are for your university to be engaging perhaps better with the student body and to be kind of helping you better through this difficult time?
I think it's really important that schools continue to provide students with adequate mental health support, even when this support can't be accessed in person right now. So if this is continuing to provide services through school counselors over the phone or Skype, or if that's not possible, providing students with other resources, I think it's really important that, especially during times like this, that the mental health of students be taken into consideration. And more from a post-clinical perspective, I think that professors and instructors need to consider how stressed they are with having to deliver their courses in an alternative manner, and realize that it's extremely likely that their students are experiencing these feelings as well and are just trying to finish up their school year to the best of their ability. I think they need to be flexible and cut students some slack, especially like if an assignment is taking a bit longer than expected to be completed. Some students at home might be stuck taking care of younger siblings if their parents are still working, since childcare isn't available right now. They might have to take care of older family members, or find work to help make ends meet, since so many are stuck without their jobs right now. And finally, I don't think that exams should be happening, at least not in the context of an online webcam proctored exam. I think that if it's absolutely necessary that an exam happen, that they should be open book with a flexible time frame for completion, so that can account for students who might have jobs or internet issues, or they should just be replaced with final assignments where students still have the opportunity to showcase their learning, but in a way that's a little bit less stressful for them. For example, one Ontario university actually gave students the option to write their exams if they thought that their grades could improve, but there was also the option to finish the course with their current mark, or accept just the credit if they were successful in the course, if their mark might not have been as high as they'd hoped. So I think this is great, because I know sometimes maybe if a student has struggled in a course but has really studied hard for an exam, they might still want the opportunity to showcase their learning in that format. But then for students who have achieved high grades throughout the course and won't really be impacted by not taking the exam and have bigger things to worry about, such as if they're struggling or have family members who are struggling, I think that's a really good way to give the students some freedom and to take the pressure off.
It's really interesting in terms of actually our next question. Our next question was going to be sort of, after having discussed what institutions can do, kind of going into what they need to do. And sort of, I think you really touched upon some of what that can look like. So not just looking at mental health from the context of, delivering services of support and wellness, which is important, but also looking at it from an academic perspective, and how is the academic experience as a whole creating additional stressors that maybe don't need to be there in the current moment. I kind of want to actually maybe jump back to Kevin potentially, in asking what stakeholders need to be engaged to achieve these sorts of moves forward in terms of the broader experience of mental health on campus. Of course, we talked about engaging youth, but maybe I'm sure we have kind of people working in clinical services listening in. I know for a fact we have youth listening in who are very interested in mental health advocacy. Who should they be trying to reach? Who are the people to really be kind of communicating with in this time?
That's a good question, Feo. I think during times like this, it's really imperative that we are engaging with all levels within the university, and that means not just students and service providers connecting, but students connecting with the senior administrators within the institution to be able to have a really strong understanding of what the frontline impacts are for students in our community, as well as for faculty and staff and the challenges that they're facing. I think there needs to be strong connection because institutions over time have more and more begun to collaborate and coordinate with off-campus services and supports, and in some cases almost completely rely on community resources. It becomes imperative that we have strong ties and conversations with off-campus stakeholders, be that government, be that off-campus youth organizations, be that service providers in the community, because that's going to be where many of our campus members turn for support, especially for 24/7 support after hours, whether those are phone or virtual or whatever the case may be. So I think those connections are important. I think strong voices back to local and provincial federal levels of government as well, to be able to advocate for the needs of the student community and the campus communities, to provide a really strong sense of what the opportunities are for partnership between government and post-secondary institutions is a really key opportunity that needs to be discussed as well.
Yeah, I think that government relationship is a particularly interesting one now, as there's a lot of, I think, discussions, more than perhaps at any point in this generation so far, in regards to sort of increased funding for mental health services, and sort of fundamentally if we are to make right choices about where that money goes and about how it's used, there needs to be that relationship between institutions, between youth and community services and the government, in sort of aiding in the decision making on that. Thanks, Kevin. Thank you. So we're gonna go into our final question here before we go into our Q&A, and it's really sort of a wrap up. I'm going to direct it to Gina first, and basically it's, what are your final recommendations or key takeaways that you want to share about how we can better support youth mental health in the post-secondary context during COVID-19, especially given everything that we've discussed here, which is a lot. It's a breadth of topics here. So I'll leave it to you, Gina.
Thank you, Feo. I have actually a couple of I'm going to try to summarize a bit what I've heard, and then I'm going to just build on some of these ideas as well. I want to speak a bit to the issue I believe that Kevin and Alison alluded to as well, which is that we are, I think, all thinking about how to respond to, how to support students who are living on the margins, who are struggling with social determinants, who are struggling with discrimination and racialization. I think Alison beautifully described how we need to, like the pandemic and other crises have actually exacerbated inequities and issues around access. So we need to be very thoughtful about how we're going to respond to some of these issues. So what I'd like to talk about as well is how we can, as a community, how post-secondary schools, colleges, universities can continue to work closely though with traditional mental health services. Because although we're saying that we need to think broadly about how to promote mental health wellness and create routines and address some of the academic challenges, I also really want to emphasize the importance of how we can support students, youth who are struggling with serious mental health issues, who may be really, isolated and struggling with suicidality and serious substance abuse and eating disorders, depression, anxiety. And I think we need to start to anticipate how we're going to respond to what might be a wave of serious mental health issues that we need to urgently address. I I do wonder whether this is a really great opportunity for us to be thinking about how to leverage mental health platforms or technology in a way that will increase access to supports for people 24 hours a day, 7 days a week. I think students are again, as Alison was saying, like, we need to make sure we have early access and also make sure we're getting the right services to people at the right time when they need them. And so I feel like that's really critical. I want to just reiterate a couple of things that have been said as well around the importance of youth and family and maybe faculty community engagement, that if we're going to come up with responses that are going to be meaningful, we need to make sure that we're co-designing solutions with the student communities, and there isn't going to be one response. There's going to be multiple responses, and I think having the flexibility to be open to the fact that we're going to continue to live in I think in the next year or 2 years, there's going to be constant change, and we're going to come up with a solution that might be okay for a short period of time, but then we're going to have to be really flexible and continue to be responsive to the changing needs of our students. What else? I think peer support. I'm a real advocate of peer support. I think peer support, natural supports can really be critical here. I mean, maybe some creativity that I've heard, and I know some folks have been asking about, and innovations. I think perhaps students can play a role in providing peer support to other students who are struggling through the use of technology. Maybe there's an opportunity for more self-help or support groups online. That might be something that could, again, be initiated by students and led by students. I just want to find my final point that I want to make, and it's to reiterate something that Kevin talked about, the importance of breaking down silos at this point and really making sure that, post-secondary schools are not just only working at collaborating, communicating, supporting each other within our institutions, but that we need to really be working alongside our colleagues who work in mental health, traditional mental health services, community-based organizations, because we're all going to have to really, I think, work together to respond to, I think, what might be significant, a wave of significant, mental health concerns across our student and faculty and staff. So I'll just end there. Thank you.
Thanks so much, Sheena. That's actually a great sort of summary of everything we've talked about. I was wondering if anyone wanted to add to that, kind of maybe summarize as well. Kind of maybe jump in. I know, for example, because we had a bit of a list here of who's going to be speaking. Alison, you're down here on the list. If you feel that there's kind of something else to add to the discussion.
Sure, just briefly, I think Gina did a beautiful job summarizing sort of the main points that came out of this. For me, I'm thinking of the fall semester that's coming. We still don't know, a lot of us, whether we're going to be continuing remotely or in person. But, thinking about e-mental health and the coming semester, I think that institutions are going to start having to think about better ways to deliver mental health services at a distance. Actually, when I was at Access a few years ago, I wrote an e-mental health guide, so I'll plug it because I don't know how much it gets read, but I think now more than ever is a time to dust it off and have a look. It's on the website. But sort of, there's often a lot more than we think of in terms of e-mental health options, and I think that's going to be sort of a new avenue of development of services, which, I think the downstream effects of that is more mental health care for people in rural and remote regions. A lot of students, at least a lot of the students I worked with this year, are international students, and they may have gone back home to their home countries, and they may be doing the fall semester at a distance. So are the ways we can still support students who aren't physically around. And I guess I'll just wrap up with saying, we know that students are at risk for mental health problems. You cited a lot of statistics, and obviously with everything that's going on. And we know that it's sort of the age where a lot of mental health problems first appear. But at the same time, I really want to emphasize that our students are really resilient. Despite sometimes coming from really difficult circumstances and having, some trauma or some baggage that they might be bringing with them to school, it's a big thing for students to make it to post-secondary education. It shows that they have a lot of strength. They're young. Now is the time when they can be making changes, be growing, be becoming sort of healthier, or sort of figuring out who they are. So I think it's such a rich time to be sort of working with people. And I think that actually, you know, they're really well poised to come out of this doing okay. And I think if we can do a good job as service providers and sort of supporting that, you know, I'm very hopeful about this generation and everyone sort of finding ways to grow and learn and be resilient through this. So that's where I'm at.
Thank you so much. And I think that's really interesting because the point you mentioned about sort of the rural mental health component, I've actually been discussing that with a couple of my fellow medical students. I think it points really interestingly to sort of the possible benefits of all of this, that finally we're seeing significant movement forward on mental health that's going to bleed out into giving people in normally communities with poor access to resources, maybe significantly better access through the internet. Sorry, Kevin, kind of ran over you there.
That's okay. I thought Emma McCann's question, I thought, just works nicely with sort of the closing conversation that we're having right now, which is asking about, you know, how do we support students that are re-entering post-secondary environments. So I thought I'd just sort of speak to that a little bit and tie together some of our colleagues' comments as well. I think one of the things that this group was talking about as we were preparing for today's webinar was reflecting back on previous incidents that have occurred over time, and we've heard a little bit today just about one of the things that has, I think, happened at a national level, provincial level, is certainly trying to open access to various types of mental health supports, whether those are virtual supports or additional services and resources. And I know campuses are doing what they can with the resources they have to try to innovatively offer options for students. One of the things we were reflecting on collectively was the reality that often it's just the basic needs right now that people are trying to address and are struggling with, whether that's food or housing or just trying to figure out where finances are going to come from. And certainly going into the fall, other considerations around access to technology if we're looking at a long-term need for alternative ways for our community to access classes and so forth. And so I think one of the things that we can collectively be doing as institutions, students, faculty, staff, working together, is to really engage in meaningful ways to consider we've heard about food security through food banks and so forth. What are the innovative ways that we can try to ensure that we're addressing food security for members of our community? Housing obviously is going to be an issue, and doing that in safe ways, especially within our residences, some of which are designed for very close contact. So having those conversations about what are the opportunities both on and off campus, what are the costs attached to that, and are there opportunities to put in place financial supports and alternative ways of delivering housing and so forth. An interesting one that we've discussed in a few different situations at the U of A is with regards to safety, and not just safety in terms of being safe on campus and so forth, but just home safety, and recognizing that there are individuals who may not be safe at home, and are there ways that we can reach out to offer support and offer a hand to individuals to ensure that they're kept safe and able to continue with their academics and with the other aspects of their life. I think the last thing I'll say very briefly is I think we all have to embrace the fact that this will not go back to normal come September. There's not going to be a magic switch that turns on and off. And I know we were talking about this morning, some of our team here at the U of A, talking about students who are putting off reaching out for support because they're just going to wait until the services go back to normal and then they'll do what they need to do. And my fear is that for that approach, there isn't going to be a normal. And it's likely going to be a long game. And even when things do return to normal, it'll be a new normal with different ways of delivering supports and services and in blended fashions and so forth. So I think encouraging people to embrace that now and be thinking differently about how we access classes, how we access the supports we need, and to ensure that we're not just deferring something that's going to spiral further and further into areas where it's more challenging to access supports later. So, thank you.
Thanks, Kevin. I think that kind of what you closed on actually raises a really huge kind of question of the general way in which we view this whole situation, and whether we view it as sort of a temporary passing phenomenon or sort of the beginning of a different era of sorts in our society, in our civilization. Huge, broad questions that have, despite their size, as you say, extremely direct implications on mental health service delivery and the post-secondary experience in general. I was going to say that it would be interesting to hear Emily's kind of position on this whole question of kind of the return to classrooms, but I see that she actually responded to that in the Q&A by type, which is great. I see that a lot of you have been responding to stuff by type. So I'm going to dive into a question that hasn't gotten a response yet, which is here from Alyssa. I think we're going about 2 minutes overtime at this point. Maybe we'll go for another 5 or 6 minutes, and then we'll start to wrap up. So maybe this question, and then maybe if we have time, we'll do one more. But Alyssa says that Alison mentioned peers taking action, and a Facebook viewer along with Gina also mentioned peer support. And so I'm wondering what role you think universities and institutions can have in supporting students in initiating this, particularly with that clinical support that Alison mentioned. So I'm going to kind of open that up to anyone if you want to talk about sort of peer support services and how they can look like, how they can be started up, pragmatics of peer support in a sense.
I can hop in. So one thing I've been thinking about is how, peer support is a very broad spectrum of things that it can be, right? And it can go from sort of just general kind of open, supportive listening type things to, psychoeducation. It can be sort of focused around a certain subject area, or for example, sort of certain peer groups. So if we think of, you might have like an Indigenous peer support group, or a peer support group for people who speak a certain language, for example, on campus. So I think one of the things I'm thinking about is sort of what kind of modality, so what kind of structures of peer support do we think are needed, and do the students tell us are needed? Whether it's training students to provide more information from more of like a public health kind of standpoint, or whether it's sort of that one-on-one, or whether it's in a group. And then also sort of like, what are these groups, these populations on campus that might be especially needing that kind of service or benefiting from it. So, and there, I really think that these underserved communities is where I would look. Even, for myself this year, providing services, among all the interns this year, we had one person of color, which I think makes no sense. And it's something we did talk about, but, and I counseled many students for whom English, like I counsel in English and French, but I had some for whom French or English was not their first language, and I think would have benefited from some mental health supports in Mandarin or in their whatever their first language was. So I think trying to support those groups, I think that's where peer support can really play an important role. And I think university administrations and structures can help by providing space, by providing some funding, by providing sort of clinical support in case of safety situations. But I think it's really rich. There's so many opportunities to be doing good stuff with peer support, I think.
Thanks, Alison. I'm wondering whether anyone else wants to dive into that kind of notion of what peer support can look like. I think we heard some really interesting things about sort of the way in which peer support can counterbalance potential lacks of diversity sort of in the institutional structure. Does anyone else want to maybe add to that? Or we can kind of look maybe at one more question. So,
I could maybe add a little bit. I saw in the chat that a student from the University of Toronto was mentioning that they offered counseling services 24/7 and had these services available in over 100 different languages, which I think is absolutely fantastic, because I know Toronto is a big city that draws in a very large student population from many different diverse backgrounds. So I think that in terms of peer supports, other institutions really need to consider that to be able to provide the best support possible for all their students.
thank you, Emily. I think we'll go with one final question, and I kind of going to open this up to any of you. It's actually a really interesting one in the context of the discussion on peer support, and it's from Melissa in the chat on how do we ensure that PSIs are not relying on peer support services in replacement of professional service shortages. Again, I think we've had that discussion at Access, sort of finding that balance between kind of bringing youth into the service delivery context, but also making sure that that doesn't end up pushing out clinical services. So I'll open that up to anyone who feels that they might be able to speak to that.
I think that the main, for me, difference, again, between peer support and clinical services is that peer support workers are really providing support through their lived experience. And I think that that's, to me, the most fundamental difference. I think it's about connecting with other people who are willing to walk with you on your journey through, this difficult time, or provide the space for people to share. And so there's reciprocity, there's an opportunity for connections to occur outside of a traditional mental health services. So I don't think peer support could ever replace clinical services. I think that so I think that that's a really important point that was raised by someone. I think to go back to, again, what Alison was saying, and to build on this question, I think that it really is important to already look at how peer support, and we're talking about peer support very broadly here, how is peer support already being utilized in post-secondary schools? Because we're not talking about revamping peer support, we're just talking about thinking about, do we do more, provide more opportunities to bring a trauma-informed lens, to really think about, unique, maybe, instrumental roles that maybe peer support might, individual students might want to take on to help people with some of the social determinants that we talked about, increasing connections to community resources. So I think it's taking what we already are doing well and kind of tweaking it to our current context and continuing to be open. So I just wanted to really just maybe highlight some of that, because I think we already do. Post-secondary school students have already really kind of taken the lead in creating opportunities for peer support, and we're not talking about replacing that. It's just building on the great work that's already being done.
Yeah, thank you so much, Sheena. I'm wondering whether if anybody else wants to add to that. In the meantime, I'm just going to mention, as we're sort of kind of ending things up here, kind of closing things down, we have a poll that we would love for you to fill out. It's just 2 questions, and it would help us improve these webinars in the future. I think it's going to maybe come up on the screen. There it is. Yeah, in the meantime, if anybody else wants to dive into that question on sort of making sure that there's kind of a distinction between peer support and continued institutional service delivery. And if not, we can kind of move towards the conclusion.
I think it's also kind of important to consider that everybody can always use some support, whether or not they're directly struggling with their mental health. And I think that providing continuous peer support services is a really good way to help students, especially in stressful situations, or even just students who have a stressful course load, just to help them to maintain a healthy headspace and to make sure that we're helping students to not necessarily reach the point where they're needing clinical support. I know it's not a bad thing to need to access clinical services, but if the less people that are struggling with their mental health, the better, just at like when it comes to physical health.
Yeah, thank you, Emily. And I think that kind of brings us back in a lot of ways full circle to this question of the post-clinical approach, and sort of seeing how do we help people in ways where they don't need to reach that crisis point, where they can get support services before things come to a head, or maybe kind of reformatting our delivery of academics and just the general post-secondary experience in a way that people are less likely to even need support in the first place, right? To have a supportive environment that from the get-go. I think that kind of draws us to a close. My apologies to everyone listening that we kind of went a little overboard, but I think we can all agree that it was definitely worth it. We heard some really, really interesting perspectives, a whole wide breadth of views on the question of COVID-19 post-secondary, and how the two kind of intermingle in regards to mental health. There's a lot of work going forward. It's discussions like this that help us sort of map out the situation, help us see what other people are doing at different sites in different parts of Canada. And I think that these sorts of meetings going into the future are going to continue to be really, really important for us, sort of figuring out where to go with mental health services. So as you can see on the screen here, we have all of our social media. So you can follow us on Twitter and Instagram, like us on Facebook. This is only the first in a series of these webinars. So yeah, follow us on social media to find out when the next one is coming up. We're going to be discussing these sorts of fascinating topics with fantastic panelists again and again, hopefully. Again, this was recorded. So you'll be able to watch this and listen to this on Facebook if you want to share it, or if you want to kind of look back and check on some information that you heard, something that was interesting to you. So yeah, stay safe, stay healthy. I hope to see you all again in this space soon at our next webinar, and even more, I hope to see many of you again in person when all of this blows over to an extent. Thank you to our audience for listening. Thank you again to our fantastic panel, Kevin, Gina, Emily, Allison. Thank you. And yeah, have a great rest of your week, everyone.